Much has improved across the NHS and social care in Gloucestershire over the last 20 years. For example, more care is provided in people's own homes rather than in hospital. Other health professionals are now doing tasks previously done by doctors, and there have been significant advances in the treatment of illness. However, over the next 20 years, the number of people aged over 85 will more than double. We also know that many young people are drinking and smoking too much, have a poor diet, and don't do enough exercise. If nothing changes, many more of us will be living with multiple long-term health conditions or disability. Due to increasing demands, our current health and social care system will struggle to cope. It is already very difficult to meet everyone's care needs, and combined with rising costs, this means we're running out of money. Also, people's expectations of what the NHS and social care should do are rising. We need to look at how we can care and support people into the future. Care is currently provided by a number of different organisations, and it's not always joined up. Although things have got better, many people are still staying in large hospitals longer than they need to, and sometimes they don't need to be there at all. They could get more of their care and support at home or in the community. So how will the local NHS and social care work with its partners to meet these challenges? We believe the best way is to focus our efforts on supporting people to live healthy lifestyles. Also, we want to help our staff and those that work with us to support people to take greater control of their own health. As local organisations responsible for health and care in Gloucestershire, we believe that if we work better together in a more joined-up way, we can transform the quality of people's care. And making the most of new technology and staff skills will mean we can do all this better. Let's tell you about Jack and what benefits working in a joined-up way can bring. Jack is 84 and suffers from a lung disease, a condition that makes it hard to breathe. He also has type 2 diabetes. Jack was coping okay till his daughter moved away, but now finds it hard to work out which service to call when he thinks he needs support or care. He also feels lonely at times. Jack visits his GP surgery about his breathlessness, and he sees a diabetes nurse about his medicines and eating. But he gets frustrated because he doesn't have enough time to tell them all his concerns, and sometimes he forgets who he has told what. Jack calls his surgery frequently to update them on his health, but they're not always able to offer him the same person to talk to each time he has a worry. Sometimes, because he doesn't know who to call when his breathing gets bad, Jack phones an ambulance. In hospital, he sees a lot of different doctors and nurses, and he feels that he keeps repeating himself. He sometimes gets confused and can't remember important things about his health and the name of the medicines he's taken, and Jack often has to wait to be assessed by social care before he can go home. All this means a lot of waiting in hospital. And when he gets home, a lack of coordination between care professionals means he doesn't get the right care and support at the right time. Eventually, after several hospital visits in just a few months, it's decided that Jack can't live on his own and needs to live in a care home. But what if Jack's services were more joined up? What if there's a local integrated community team with GPs, community nurses, social workers, therapists, and others who support people like Jack to live in their own homes? One of the team, Fiona, a community nurse, is given overall responsibility for coordinating Jack's care. Fiona meets with Jack and his GP. Jack explains that he wants to manage his condition at home, and together they develop a care plan which they can all access securely online anytime. In Gloucestershire, hospital and community respiratory healthcare professionals are brought together into a single team, and they're able to provide specialist care, support and advice in a joined-up way. When he does have a crisis, Jack calls Fiona rather than an ambulance. Fiona is able to call in experts from the Gloucestershire respiratory team to visit Jack in his own home and provide care. On one occasion, when his breathing is really difficult, Jack can't reach Fiona straight away and calls an ambulance. Rather than taking him to hospital, the ambulance crew assesses Jack's condition and then makes arrangements for the Gloucestershire respiratory team to be called. They visit Jack at home again. Jack doesn't need to go to hospital as often, but when he does go, he sees a nurse from the Gloucestershire respiratory team who knows lots about him and his health. He doesn't have to repeat his story to lots of people. He's able to leave after a quick review of his care plan, rather than having to be reassessed. Fiona also arranges for the nurse from the respiratory team and a diabetes nurse to visit Jack at home at the same time and provide him with some easy-to-read information and advice about things like inhaler technique and his medicines. Jack's health and social care is funded from a joint budget, so the team can make really good decisions about how money is used. For example, as his health gets worse, the team arranges for someone to go in and raise his armchair at home, so Jack finds it easier to get up. They also arrange for a home care assistant to visit twice a week to help with tasks around the house. And after an assessment by the respiratory team, they provide him with an oxygen cylinder to ease his breathing. To help reduce Jack's loneliness, Fiona makes contact with the local village agent. She is able to arrange for a volunteer from a local gardening club to help Jack once a week with his own garden. Now, Jack can go on living in his own home with the right support, and he doesn't need to move to a care home. He feels more in control, better supported, and better use has been made of resources which support him. Let's summarise briefly what transformed Jack's care. The NHS, social care services and other community and voluntary partners created a shared vision for good joined-up care, meeting the needs of people like Jack. They combined resources across health and social care, developed joined-up health and social care teams, and created systems allowing Jack's information to be easily shared in a secure way with the professionals involved in his care. Sound impossible? Well, this is already starting to happen in Gloucestershire. You can read more about our plans, called Joining Up Your Care, and tell us what you think at www.gloucestershireccg.nhs.uk.